Hello, my name is Joie-Claire, and this is the closing project video about the quality improvement of healthcare, and I'll be answering different questions that were asked. So the first question is about how does the status of healthcare quality look like in developing countries settings? And to answer this, in developing countries, the quality of healthcare is still poor compared to developed countries due to limited skills and poor education of healthcare professionals or providers. And as a result of this, people are given poor care services, quality, and healthcare is not afforded by everyone. So the limited skills of specialists lead to the poor quality care services offered to the patients. And according to the Johns Hopkins Bloomberg School of Public Health, people in poor countries tend to have less access to healthcare services than those in better off countries or developed countries. And within countries, the poor have less access to healthcare services. So this is the impact that healthcare services have on people with less abilities to afford good healthcare services. And the second question is asking what are different risks that patients are experiencing due to the lack of quality of care. So there are different risks or things that patients are exposed to due to the lack of quality of care. And the first thing is the medication administration errors that are committed by healthcare providers due to their limited skills and knowledge about the patient's illnesses. And the second risk is death and illness complications, because when a healthcare provider attends to a patient without having enough knowledge about his or her illness, he tends to administer poor recommendations for recovery. And the next risk is the development of preventable chronic diseases and death and increased morbidity rate and inadequate or poor health related decisions that patients take due to bad advices that they were given by healthcare providers. And according to a report that was written by the Brookings Institution about improving quality and value in the United States healthcare system, patients with chronic diseases such as hypertension, heart diseases, and diabetes are all too often do not receive proven and effective treatments such as drug therapies or self-management services to help them more effectively manage their conditions due to a lack of coordination of care and for patients with chronic diseases. And the next question is asking what are the priority areas that need much emphasis in terms of quality improvement. And according to the National Center of Biotechnology Information, the priority areas that need much emphasis in terms of quality improvement are self-management or health literacy, because many people do not have enough knowledge about how they can take care of themselves, and this leads to the development of different preventable health conditions. And another area that should be focused on is the cancer screening, because most of the time people find themselves at the last stage of cancer without having known that they had cancer in the first place. So this is another area that needs to be emphasized on. And the children with special healthcare needs this is an area that needs to be improved on, because many children in our world are suffering from different diseases and they do not receive the adequate care. And the diabetes focus on appropriate management of early disease should also be focused on in order for people to learn different health habits that they need to adopt so as to take care of themselves in case they have diabetes. And the screening and treatment of major depression. The next thing that should be emphasized on is the pregnancy and childbirth, and medication management through preventing medication errors and overuse of antibiotics. And obesity is another area that should be focused on. And the last thing is tobacco dependence treatment in adults, because many people are addicted to different drugs and they do not know how they can free themselves from that. And the next question is asking what are different interventions that stakeholders of healthcare industry should take into consideration for remediation. So the first thing that healthcare stakeholders need to do is that they need to partner with successful organizations in order for them to provide financial support to them, so as to use that financial support to improve the infrastructure and different equipments, medical equipments that they will be using in order to provide high quality care services to the patients. And the directors of healthcare institutions or facilities should provide trainings to all the staff members so as to equip them with skills they need and about health and provide. As I was saying, the directors of healthcare facilities should provide trainings to all the staff members so as to equip them with different skills they need and about health in order to provide high quality care to the patients, because one of the challenges that healthcare facilities are facing is that the staff members or the physicians lack enough knowledge about different health conditions that patients have, and as a result of this they end up administering different medical treatments that are not that do not match their diseases or their health conditions. So by providing enough trainings to the healthcare providers, they will be able to also provide high quality services to the patients. And another thing that healthcare stakeholders need to take into consideration is that healthcare professionals should be in collaboration with the government by setting different health policies that favor high quality services delivery. This means that health policies should be established, and these policies will serve as a guideline for healthcare providers to provide good quality services to patients, because most of the time healthcare providers neglect their responsibilities and they end up being careless about the patient's conditions. And when the patients feel neglected, they do not open up and tell their health conditions to the healthcare providers, and as a result of this they do not get adequate medical treatment. So this is something that healthcare providers need to take into consideration. Another thing that they should do is that first of all, one of the challenges that healthcare facilities face in Rwanda is limited equipment. So stakeholders of healthcare should ensure that there is effective distribution of resources in healthcare facilities by considering that their infrastructure and number of patients, because most of the time there are healthcare facilities that receive a large number of patients, but in the end they have limited equipments to be used in the medical treatment of patients. And when the number of available equipment doesn't match the number of patients, they end up providing poor quality services to them. So a fair distribution of resources and equipment in hospitals should be done by the government and other people that are involved in the distributions, so as to ensure that all healthcare facilities have equipment that match their patients. Thank you for your attention.